Hi, Cassandra.
Hi, great to hear from you. How are you today?
I'm good, thanks. And you?
I am always excited to talk to you.
Same here. So, what do you know about diabetes?
Is your health okay?
Yes, I'm just curious. Lots of people I know have diabetes.
Good to know you're fine. Diabetes is a very widespread condition. About 400 million people worldwide have diabetes. Globally, it costs $600 billion a year to treat.
That's a lot of people and a lot of money.
Yes, it is. First, remember, we are going to discuss general information, not medical advice. It's best to talk with your doctor if you have medical concerns. It's important that you understand.
Yes, I understand.
A large percentage of those 400 million cases could be prevented with a healthy diet and daily exercise. But before we start, can you answer a few questions?
Sure, I can do that.
Super. Let's begin. Do you have any of these symptoms? Frequent urination? Thirst? Do you feel tired all the time? Or are you losing a lot of weight?
No, none of those things.
Great. Tell me, when you cut yourself, do you take a long time to heal? Do you have blurred vision? And one last question, are you overweight?
No, but maybe I should lose a few pounds. But you don't worry about pounds, right?
No, not pounds, but I do worry about gigabytes and processor speed.
Hey, that's funny.
Thanks. A little humor helps with the bedside manner.
Can't argue with that. How did I do?
Good news, you have none of the symptoms. It's quite unlikely that you have diabetes. To be sure, you do need to see a doctor and get tested.
That is good news. What is diabetes?
Most likely you could state that more clearly.
What is diabetes?
Diabetes is a common lifelong health condition.
So it's a serious health problem then.
Yes, but as I said before, if you eat healthy and exercise, you can prevent diabetes.
There is hope then. What causes diabetes?
Diabetes is a condition where the amount of glucose in your blood is too high because your body cannot use it properly.
Why can't the body use it?
Because the pancreas does not produce enough or the right kind of insulin. Insulin is important because it helps glucose enter your body's cells.
I see. What's insulin?
Insulin is a hormone produced by the pancreas that allows glucose to enter your cells. And glucose is the fuel you need to work, play, and generally live your life. It's vital. There are three main types of diabetes.
Three types of diabetes?
Yes, three. Type 1, Type 2, and gestational diabetes, or GDM for short. Type 1 diabetes is usually diagnosed in children and young adults and develops when the insulin-producing cells in the body have been destroyed and the body is unable to produce any insulin.
Mainly children and young people get type 1?
That's right. But 90%, or most, of all cases of diabetes is type 2. It's caused by insulin resistance and/or lack of insulin.
What's the third diabetic condition?
That's the rarer gestational diabetes, or GDM. It is caused by high blood glucose levels during pregnancy. GDM develops in 1 in 25 pregnancies worldwide, and it affects both mother and baby.
Can you prevent diabetes if you discover it early?
There is a prediabetes stage. Prediabetes means your blood glucose levels are higher than normal but not high enough to be diagnosed diabetic. There is good news: you can prevent or reduce your risk of getting type 2 diabetes with modest weight loss and moderate physical activity.
Good to know. How do I know if I need to be tested for diabetes?
Anyone who has concerns should take a test, but you are more vulnerable if you are aged 45 and over. Even if you are younger but overweight, you should consider getting tested.
Is there a cure, and what's the treatment?
There is no known cure at this time, but the future looks bright. There is great diabetes research being done to help.
Good to know the future is bright, but what's the treatment today?
Today, there is medication to control diabetes, blood pressure and blood fats. And lifestyle changes do help too. Do it before you get it. Yes. Yes?
Yes, thanks. It's been enlightening.
You are welcome. Remember, what we covered here is general information, not medical advice. Always see a qualified doctor for that. I can book you in for a checkup when you need it.
Glad to have you near.
Good to be appreciated. To quote Hippocrates, natural forces within us are the true healers of disease. Let's discuss healthy living, eating healthy, exercising, and taking control of your well-being. All you gotta do is call